What should you know about cleaning and disinfecting? Most cleaners and disinfectants kill COVID-19. The guidelines say to disinfect high-touch or frequently touched surfaces at least 2 times per day. But if there's lots of traffic in and out of your space, as you never know who may be infected or didn't practice protection protocols, you may want to disinfect more frequently than 2 times per day. Disinfecting more than 2 times per day is especially important if surfaces and items are visibly contaminated from handprints, dust, smudges, etc. Remember to clean visibly contaminated surfaces first before disinfecting. When disinfecting, you should always work from the cleanest surfaces or parts to the dirtiest or high-touched areas, and do not go back with your cloth or wipe to the cleanest spot you started at. What to clean? All commonly touched or frequently touched surfaces and items should be disinfected to rid them of droplets or hands that may have transferred the virus through contact transmission. These surfaces and items include door handles, knobs, elevator buttons or buttons of any sort, light switches, toilet handles, counters, handrails, touchscreen surfaces, keypads, and items used by clients and visitors like pens and waiting area furniture. Waiting area furniture should be cloth-free so they can be wiped down with a disinfectant. The World Health Organization recommends regularly disinfecting desks, tables, and other work surfaces. In a recent study, researchers found that average desktop harbors more than 20,000 germs per square inch. That's 400 times more contaminated than a toilet seat. Yuck. Selecting cleaning products. There are 3 types of cleaning products: cleaners, disinfectants, and disinfectant wipes. Cleaners break down grease, dirt, and grime and should be used before using a disinfectant. However, some cleaners may be both a cleaner and disinfectant, which are called one-step. If you don't have a cleaning product, either alone or in your disinfectant, to clean up grease, grime, and dirt, a simple thing such as using water to do a wipe down before using your disinfectant will help remove dirt and dust. Disinfectant should have a DIN, or drug identification number, or an NPN, a natural product number, and or be on the Health Canada approved list. Disinfectants may not always have a DIN or NPN on the label due to shortages of products and a temporary measure by Health Canada to get these products out to the public, but it should come with a product safety handling sheet or be displayed or available where you buy the product. This is a good reason why you've got to look at the Health Canada approved product list via their website by putting in Health Canada Disinfectant into your internet browser. Health Canada website is also good to check for product recalls like disinfectants, cleaners, and hand sanitizers. Health Canada/EPA recommended hospital-grade disinfectants against COVID-19. Here is an example of some of the hospital-grade disinfectants that are recommended for use against COVID-19. Included here is the active ingredients listed in the center column and the needed contact time in the column on the far right for the disinfectant to be effective at killing the virus. Health Canada lists these products' names and has other information on them, such as when the product was approved. Health Canada recommended common disinfectants. This is not a complete list of common disinfectants you might know, but is a snapshot of some familiar household product names you might be familiar with, like Clorox, Comet, Fantastic, Simple Green, Spick and Span, Lysol, and Scrub Free. Each of these companies' products have particular names for the disinfectant that is approved to work against COVID-19. There are many more listed on the Health Canada Disinfectant website, but these were some of the common ones that were there. The Health Canada link is at the bottom of this page, or go to their website to find the info. Masks, wearing a face shell. There are 3 types of mask: a respirator mask, surgical mask, and a cloth mask. Masks are considered types of PPE, or personal protective equipment, and are a type of source control to prevent spread of COVID-19, as well as provide certain levels of protection. We will call masks a face shell because it protects us much like a turtle's shell protects its body. Respirator masks are commonly known as N95s, but come in greater filtration levels like N99s or N100s. Respirator masks are reserved for healthcare professionals like doctors and nurses. Surgical masks are recommended for healthcare clinical settings for healthcare providers or patients. Cloth masks are for anyone not in healthcare settings to use in the public, including work, attending schools, and shopping. With masks, some people feel like they can't breathe. However, there is enough oxygen that does flow in and out of the mask to breathe properly without any concern of carbon dioxide buildup or an inability to get fresh air. A person can breathe safely because cloth masks and even surgical masks have enough space around the nose and mouth for air to flow in and out, but should be worn for as long as a person can tolerate it. What the mask is made out of also affects breathability and ultimately how long you will wear it, which is why cloth masks are recommended to be made out of cotton or another breathable type material. Face shields. There is no evidence that face shields alone are effective either as a source control or as PPE. Face shields are usually worn with a mask instead of goggles to protect eyes from droplets. So in other words, is a choice between goggles or a face shield to protect eyes from the virus. The World Health Organization suggests face shields as a source control measure only when cloth masks are in short supply, unavailable, or when mask use may present challenges for certain people like those with certain mental health disorders, developmental disabilities, and impaired hearing to read lips. Face shields should cover the sides of the face and extend below the chin. The Center for Disease Control does not recommend the use of face shields for normal everyday activities, for newborns or infants, or as a substitute for cloth face coverings if available and can be worn. Of note, there are some face shields that cover under the chin, called chin guards, and do not have any spacing on the sides, so cover the whole face to the ears, and these may provide a bit more protection. But again, there is no evidence to date on face shields being effective as a source control or as PPE. Respirator masks. These are commonly known as N95 masks, and they must be fit tested by a specially trained technician using a special machine called a porta-count to ensure that the model number fits your face, or it won't provide the 95% protection that is needed. N95s do not come in sizes small, medium, large, extra large. They come in model numbers like 8210, 9210, 1870 plus, just to name a few. So if a 9210 fits me, it might not fit you. And it's mask fit testing using that porta-count machine that ensures that model number fits you or what model number fits me. Again, N95s are reserved for healthcare professionals to help protect them during the pandemic. Workers in hazardous materials environments may even wear respirator masks greater than N95, like an N99 or N100, depending on their contaminant exposure types and filtration they need because they work with hazardous materials such as sewage, or where there's gases, fumes, particles, and vapors, or for some roles in a nuclear power plant. Healthcare professionals need these N95 masks to perform aerosol generating medical procedures, or AGMPs as they are known, and these procedures can include intubation, like when they stick a tube down your throat so you can breathe, when doing CPR, surgery, open airway suction, or administering high flow oxygen therapy, or using a CPAP or BiPAP machine. These medical procedures generate aerosol droplets, and they are very small and can linger in the air for very long periods of time and travel further than other droplets due to their aerosol size. Surgical masks. Surgical masks are generally reserved for healthcare providers, those in clinical settings, for patients who must leave their hospital room for when, say, they are going for an X-ray, or for those who leave their room when in long-term care facilities or going into the community for health care, like dialysis or treatments. The reason for this is that healthcare providers often have to get within 2 meters or within 6 feet of a patient, and vice versa, which is why they need to wear surgical masks. The outside of the mask is the side you see when you pinch it out from the box with clean hands. However, If not in a box face up and you are not sure what side is the front, you may put the white side against your mouth and nose, as this is what healthcare providers do. Cloth masks. Cloth masks are recommended by Public Health Ontario for anyone not in a healthcare setting, who are age 2+ and for those who can put on and take off their mask without assistance. However, Health Canada will be releasing recommended guidelines for those age 10+. Cloth masks should be made with 2-ply material like cotton, as it is more breathable and ensures the mask wearer wears it with comfort for as long as possible. Some cloth masks have a valve, so the wearer can exhale their breath. However, the valve allows exhaled air to be released, thereby contaminating the environment. So valve-type masks are not recommended and outright banned in some places. Cloth masks block at least 50% of particles similar in size to SARS-CoV-2, which is 0.1 microns in size. We wear cloth masks because we are often in shared spaces, can't physical distance 2 meters or 2 arms length, and we are always expelling droplets even when we breathe, talk, laugh, cough, sneeze, or sing. How to wear a cloth mask. Clean your hands with soap and water or alcohol-based hand sanitizer for a minimum of 15 to 20 seconds before and after handling your mask. Make sure it fits snugly with no gaps between mask and face and covers the nose up to the mid-bridge of nose. Covers the mouth with bottom of mask worn to under the chin, but secure it so it doesn't hinder breathing and vision. If you readjust the mask, use ear loops and ties. Do not touch the front of the mask to adjust it. Avoid touching the front of the mask or face covering while wearing it. If you do, clean your hands immediately. Wear it as long as it is comfortable and remove it when it becomes soiled, damp, damaged, or difficult to breathe through. Do not share your mask with others. Always remember hand hygiene before and after touching your mask. If you need to remove mask or face covering from your nose and mouth, do not wear it or pull it down beneath your nose, to your chin, or neck, or you will get possibly contaminated droplets or virus on yourself. Do not lean on the mask with your hands or rest your hands against your face or chin, or this will increase risk to yourself and others. Again, because we have to wear cloth masks for extended periods of time, it should be worn for as long as is tolerated, which means you may need to increase your tolerance of masks or help others, like children, build up a tolerance for them. Try wearing them for chunks of time to build up a tolerance. And if you need to take a break from them, go outside or to a place where no one else is and safely remove the mask to take a breather. Just remember, when you are wearing the mask, you can still breathe, and there is no harm of wearing for long periods of time, despite feeling like you can't get enough oxygen. How to remove and care for cloth masks. First, perform hand hygiene by using soap and water or alcohol-based hand rub. Alcohol-based hand rub should have a minimum of 70% alcohol for healthcare settings. When taking off your mask, even for short periods of time, you can remove your mask by using the loops or ties, and if you must, touch only the corners. Ensure to store it in a paper bag or paper envelope so that it doesn't build up moisture, get more contaminated, or grow critters. Last, you must perform hand hygiene again since you've touched and handled your mask during removal. Remember, always perform hand hygiene before and after handling your mask. Be sure to wash your cloth mask with soap and detergent in hot water at least once per day. If your mask gets too moist, wet, or is visibly dirty, you must change your mask to a fresh, clean mask. Remember to bring extra masks when going out, just in case the mask you're wearing rips, breaks, or does get too moist. Masks or shells for children. Getting children to wear masks may prove challenging. Some of the challenges are risks associated with children wearing their masks, such as if they have asthma or a medical condition, not having the intellectual ability to understand why they need to wear a mask due to their age, or if they have a disability, just plain old touching it or playing with it and wearing it incorrectly. The best approach with children is telling them why they need to wear masks at a level they can understand. Perhaps telling them that it will keep bugs out, and that right now we have these bugs that we can't see, and they're making everyone sick. So to stop others and themselves from getting sick, we need to wear masks. It's important to tell children not to touch the front of their mask, as they could get those bad bugs on their fingers and hands and might spread the bugs, get others sick, or get themselves sick. Generally, kids are pretty resilient and will understand if explained in a simple, concrete way. Children must also be given frequent reminders on how to handle, wear, and look after their masks safely. Parents can teach their kids how to wear masks when they go out in public, say by bringing them to the grocery store and having them wear their mask the whole time they are in the store, so that they can get used to it in blocks or chunks of time. These blocks or chunks of time can be increased so that children can raise their tolerance level so that they can wear their masks or face coverings for extended periods of time. This will help kids get used to wearing it, especially if they will be going to school. It's good to get the practice in as much as possible so the teachers won't have to police it too much, and our kids have that knowledge and the skills to be responsible for their masks. Hand hygiene reminders before and after touching their masks will be paramount. Perhaps making it fun somehow, or relating it to real-world things they can identify with, will appeal to correct and frequent mask wearing by children and youth.